Good morning, everyone. My name is Gideon Orbach. I practice chiropractic here at the World of Wellness, as I've practiced previously with the Weiner Wellness Center, and before that, the Pain Release Clinic. Same place, new name, same commitment to quality. Nothing new there. Anyway, usually I get started with my workshops for these wellness weeks, and I have somebody give me a warm introduction. They say all sorts of great things about me, and I have to wonder if I believe them. Probably too, but anyway, I'm just here to introduce myself today and to start going. So, like I said, I do hands-on chiropractic adjustments. I work with the spine and the extremities, the feet, knees, hips, shoulders, elbows, you name it, collarbone, even a little bit of TMJ work. I do deep muscle release techniques and therapies, not quite as well as some of our very professional muscle therapists who we've had on staff previously, and now our current muscle therapist, Andrea, is incredible. I urge you all to book with her if you get the opportunity. And I also do a technique called proprioceptive neurofacilitated stretching, PNF stretching, where we work in activating muscles and then creating more flexibility and stretching them further once they've been activated. So my formula has been the same. I've learned a lot of new maneuvers here and there, but I haven't learned any new techniques over the last, I've been at it for 20 years. So I'm like to call myself the model of consistency. I also hold the initials PSP. I'm a primary spinal practitioner. The University of Pittsburgh created the first ever, as far as I know, program that's open to both physical therapists and chiropractors. So we could kind of get a sense of what professional colleagues with other job titles and different names are doing, and look at where our similarities are and where our differences are, and what the two professions can learn from each other. And I don't want to say standardized care, but certainly standardize the way we look at things. And I certainly have IT savant Phil here to help me out and make this whole production go smoother. So I got a couple areas that I'm really specifically interested in, and like I said, I do chiropractic adjusting to the spine and to the extremities, and I do a lot of muscle work and a lot of flexibility training. And the whole motivation, like my goal for every patient ultimately is to help them live more comfortably in their bodies. And I had one of my patients called his body the only home, the true home that he really knows, his only home. And there's a lot of truth to that when you think about it. But anyhow, as I was saying, I want my patients to feel more comfortable living in their bodies. And for some people, that means being better balanced, and for other people, that means having more athleticism, and they're going to be deeper breathers and have better posture and just run their bodies more efficiently. And for some people, that means getting out of pain. And every single time I encounter a new patient, we got to sit down and we have a conversation in depth about what they're experiencing and what they can realistically expect to get out of this, and what I can realistically expect to deliver for them, and make sure that we're all on the same page. And pain always comes up in that conversation, but patients are amazed at how much more vast their experience is here with our brand of chiropractic than just simply pain reduction. So anyway, I've been with this organization, regardless of the name, for coming up on 15 years now. And let's see, 4 to 5 wellness weeks, open houses a year times 15 years. Well, let's say 14 years, whatever it is. I've been through a lot of these, and I've had the chance to lecture it or host a workshop or lead the conversation or conduct a class, depending on how you see it. And I look at this as a conversation. So if you're sitting here live, keeping me company, feel free to raise your hand and ask questions and even interrupt a little bit. If you're one of my remote friends watching in or tuning in on the social media, you can go ahead and type your questions, comments, moral outrages, anything you like in the margins. And IT Savant Phil is going to help me figure out what we're getting at and how to address you. So, like I said, man, I must have been able to participate in this manner at about 50 different wellness weeks. And so what we got to do today is we got to cover quite a bit of information in a relatively short time, because we're combining a couple conversations into one. So when COVID happened, and I think we all remember how that came about and when it happened and what it was all about. and what it did to us. One of the things that happened was so many people had to learn how to work from home and develop their own home workstations. And they're no longer permitted to come to their office or to their cubicle or even the coffee shop where they work out of, and they had to work at home. So we generated a whole workshop where we talked about what can you do to create an effective, safe, comfortable home workstation. And because we got other stuff to get into today, I wanna just go over the highlights and the bullet points. First of all, if you're going to have a home workstation and you're going to set it up yourself, ideally you would have a sit stand desk. Sitting is going to increase the load on your spinal discs considerably. I mean, some practitioners and some researchers say as much as 60 to 70%. Some people say as little as 20%. So somewhere in between lies the reality. But imagine if you're sitting for 6 to 8 hours at your desk, creating more load, more compressive forces into your spinal discs, the cushioning or the shock absorption between spinal bones. That can't be a good thing, whatever the percentage is. So we'd like to have you standing more than sitting if we can. And that's why the first bullet point of what am I going to do to create a home workstation is let's look for a sit stand desk. Following along that theme of look, I can't be sitting at my desk for 6 to 8 hours just cranking out information and data and producing. We advocate for exercise breaks along the way. Now, exercise break, look, if you can build it into your day to take off in the middle and go for a walk around the block, that's wonderful. If you can take 5 or 10 minutes to do a calisthenic or a stretching break on the floor or some yoga, that's just as wonderful. And if your break means every hour I'm going to get up and do 5 or 10 seconds worth of deep breathing exercises, and then I'm going to do a postural exercise, and then I'm going to do a few more deep breathing exercises, and then I'm going to get to work. And by the way, the postural and deep breathing exercises are things that we're going to get into here today. That's fine too. That the important thing is we have to break up that routine and have to get you up and away from your desk and get your body moving and not put that kind of pressure on your spinal discs that we've been talking about initially. The next bullet point, fancy bullet point number 3, is the 90-degree principle. So if you are sitting in a chair, you want to have a 90-degree angle between your foot and your shin. So if this were my foot and this were my shin, I want this to be 90 degrees, so feet are flat on the floor. I'm going to have a 90-degree angle at my knee bend, and I'm going to have a 90-degree angle between my thighs and my torso at my hips. And I'm going to have my elbows tucked into 90 degrees as I work on the keyboard. So if you follow the 90-90-90-90 principle, that will really dictate as to what kind of height your chair should be relative to your own height, the length, the ratio between your leg length and your torso height. So we want to have some sort of individual, specific, unique juggling act to make sure that everybody is at the right height to be at their ideal mechanical advantage. And we want to have the computer monitor slightly above eye level, so you're going to be looking up at the monitor and not down into the monitor in order to maintain the integrity of good posture. We talk about the light source. This is really important that a number of people, when we finally got to do this live and we had crowds back in the building and I brought up the light source point, it was amazing how many people, wait a minute, I didn't even think of that. I can't, no wonder I feel like everything's blinding me. If we have the light source in such a way that it bounces off of the computer monitor or it's just above the computer monitor and we're not able to focus on what we're seeing or we have that glare, I'm going to leave that to the ophthalmologist of the world to explain the pathophysiology of what's going to happen with your eyes. But certainly I think everybody knows how unpleasant it is to have that bright light shining directly in your face. And we can very simply squash that problem by being judicious about where we put our light source relative to our work source. So far, so good? Kathleen says hi. Kathleen, all right, so this is nice. Earlier this week, we had a visiting dignitary, Dr. Kathleen from Tampa, who introduced us to something so spicy and delicious and brand new that we are working to integrate it into our clinic. Now, as I told you at the very beginning, Look, I'm like the model of consistency. The people who I graduated chiropractic school with 20 years, yeah, oh my God, more than 20 years ago, I still run into some of them from time to time. I adjust them and they give me zero growth awards because I do things exactly the same way as I did when I was in school, as far as which techniques and which maneuvers and which systems I'm using. And I prefer 100% consistency to zero growth, but we now all of a sudden I'm getting a little excited about the possibilities that we have in our clinic here with some of the new things that Dr. Kathleen is going to introduce us to in terms of anti-aging strategies, peptides, hormones, and we're not there yet, but we're going to get there. So sit on the edge of your seat right along with me because we're upgrading and bringing in new stuff. Spicy and delicious. All right. So anyhow, the last time I had a chance to host this was Tuesday morning, and before I even introduced myself, before I started even introducing the material, I asked the crowd, everybody indulge me and do something with me, and I'm going to make that same request right now. If you're physically capable, if you have enough elbow room, if you're able to stand up, and I want you to spread your feet wider than shoulder width apart, and I want you to raise your arms to a position where you're reaching out for where the ceiling and the wall meet on either side. So essentially, we're taking up as much physical space as our bodies will allow us to. I'm reaching way out, not just to my sides, but also overhead. So I'm occupying a vector over here where I'm not confining myself and staying in a tight, straight up and down or all the way outside. I'm meeting halfway and making myself bigger yet. And my feet are spread, my legs are spread out wider than shoulder width. So I'm occupying more floor space than I'm really entitled to. Um, I hope that everybody out there indulging me is feeling strong in their arms and shoulders and able to hold this position without problems or without fatigue, because we're going to stand here for the next 14 and a half minutes. All right. All right. So maybe not. Maybe not. Let's just all take a seat. All right. So what's this about? This is what's called a power pose. And the reference is a TED talk given by a woman named Amy Cuddy. And our principle is really quite very simple. Our physiology is going to dictate our psychology. Our physiology or our activity is going to dictate our psychology. So how many of you who I'm very grateful for everybody who indulges me and plays along with me and participates and who's all in, at least for this brief period of time that I get a chance to chat. How many of you stood there just feeling powerful? You should have.
I felt like I was ready to fall over.
We have a comment here from the couch in our coffee shop of a waiting room says, I feel like I was ready to fall over. Well, I'm gonna suggest to you that if you practice that position, not necessarily for 14 and a half minutes at a time, but for more than a few seconds, 15, 20 seconds at a time, and you find yourself, you're going to build up to 2 minutes of doing that. I mean,
probably be a little bit longer.
Exactly. The feedback was each day is going to be a little bit longer. Let's face it, it's an exercise. The idea is to show progression, to do something that challenges yourself, and to continuously get better at it and better and better. So if you start off on day one and you say, I'm going to do 10 seconds of power pose, and on day two, you're going to do 15 seconds of power pose. And on day one, when Orbach says, okay, we're going to sum this up with 14 and a half minutes, I don't blame you all for cutting out early at all. That'd be a chore. But here's what's happening, that as we take up physical space, I mean, we're convincing our subconscious mind that we're bigger than we really are, that we're more powerful than we really are, and we're activating that subconscious mind to realize that we're just simply more powerful beings. So what's the relevance of that? The human brain processes 3 trillion bits of information per second. What's a bit of information? Well, the fact that I'm standing up here leading the conversation wearing a black hoodie, a blue shirt, which I've intentionally untucked for reasons that you'll see soon, and a blue and reddish tie. Well, let's see. I'm here, hoodie 2, blue shirt 3, untuck 4, tie 5. So there's 5 bits of information right now. The fact that your heart is beating, your brain is communicating with your heart, with every single cell of your heart. I didn't sit down to count how many cells there are in your heart, but I'm guessing it's a lot, and each one of them accounts for a bit of information. So it's pretty easy to see that every single cell of your body is in constant communication with the brain. Your brain is studying your environment and reading the situation around you and taking in valuable information and valuable data every moment of every day, even when you're asleep. So with 3 trillion bits of information contextualized, it's a big, big, big number. But you can kind of understand how we racked up such a big bill. Now, of those 3 trillion bits of information, 50 are conscious. 50. 1, 2, 3, 49, 50. So how many of you are good at third grade math? Let's talk about fractions. 1 out of 2, half. That's a pretty good percentage. 3 out of 4, there's 75%. You're 3/4 of the way there. 50 out of 3 trillion. How many zeros do we have after that decimal point? My God, that's such a small number. And yet our whole world around us is being influenced by what we do consciously, and that's how we make our decisions to support whatever it is we're going to be doing all day. I'm sure that everybody listening in to this conversation has at one point or another, at some point in their lifetime, experienced pain. Everybody has. So when somebody is in pain, that drives them into action. You can think about pain as a neon sign flashing, a warning light. It's a call to action. It's forcing you to do something. Is pain conscious or unconscious? Well, of course it's conscious. It's you're very well, you're acutely aware of your own individual personal pain, and it's going to drive you into action. So here we are with this supercomputer that processes 3 trillion bits of information living inside this marvelous creation that is our human body, and we are letting our conscious world dictate what it is that we're going to do and how we're going to make decisions in life and what activities we're going to pursue and how we're going to position ourselves and how we're going to behave and so forth and so forth. So far, so good? All right. Now, once again, physiology or activity is going to dictate psychology. So our mood, our feelings, conscious or unconscious. Well, we're kind of aware of what kind of mood we're in, and if you're feeling really happy, or if you're feeling like you're in a good mood, or you're elevated up, we're kind of conscious of that, right? If you're feeling down, if you're feeling like depressed is a clinical diagnosis, it's a legitimate illness. So let's not say depressed, but if you feel like you're just not myself. I feel like I'm in that gray, foggy area. We've all lived there from time to time. We've all been there before. What are we going to do to get out of that funk? How are we going to elevate our consciousness to such a way that we're feeling productive and enthusiastic? Well, once again, our physiology is going to dictate our psychology. Our physiology is our activity. What are we doing, both conscious and unconscious? So if you're feeling like, man, I'm just feeling down, I'm in a bad mood, things aren't going right for me, I don't know what the situation is here, but I got to get out of this. One thing that you can do to help yourself is let's stand up and get into our power pose. As we were standing here, as we enjoyed this experience, how many of you felt more energetic? How many of you felt more powerful? How many of you felt like you could be more aggressive? How many of you felt like you could be more productive? That's your subconscious mind beginning to kick in and change your psychology because you changed or you took control of your activity, your physiology, and it started to dictate what you're feeling psychologically. Still so far so good, IT Savant Phil? Okay. What if we were working at our home workstation and we hit a wall? You know, I I gotta read and understand this paragraph and rewrite it and translate it into a different language. Uh, um, I got to analyze this financial data and come up with some sort of algorithm as to where the data is going to lead me and what we can reasonably expect to have happen. I got to move. I got to arrange to have all of these products shipped from point A to point B, or maybe you're involved in online education and you have a room full of third graders who are all at their Zoom locations, and you can just kind of sense that people are ready for a break. They're not sitting still. Everybody's a little bit edgy, including you, the teacher. Well, the first aspect of our conversation here, we had this very quick conversation about things that you can do at your workstation to make it better. And we talked about, well, the concept of a sit stand desk. Why do you think a sit stand desk is so important? Why is it such a good idea to stand while you're working at your workstation? Well, for example, one, you have a better control of your posture and you're going to use your body to hold yourself up rather than using the chair that you sit on. So you're going to activate certain muscles. You're going to force yourself into the appropriate kind of stance and the appropriate kind of posture. But let's say even absent that, we're talking about a very quick break to get my mind out of what I'm doing, get my body recentered, get my mind recentered, and then get back to work with fresh eyes. So what would be so wrong? I say, look, I want to take that. Maybe on day one, it's a 10-second stretch break. Maybe we're building up to 2 minutes every so often throughout the workday. What would be wrong with getting away from your workstation and just assuming Amy Cuddy's power posture number one and making yourself as big as possible and holding this position and just try it. Just stand here and try and let your head droop. It won't work. You have to be in good posture to hold your head up and be able to achieve this. Outstanding. So what's wrong? What's wrong with doing that for a time span of a few seconds to a few minutes, a handful of times throughout the day? Here's another shameless plug. I'm drinking water, of course, but I spiked my water with powder from our Pro Reds today. I endorsed the Beets on Tuesday, but today's a Reds day. Along with the Power Fuel, which is a form of D-ribose, which is a sugar that helps to. It's a special sugar that's actually very healthy for the heart and helps to fuel your mitochondria, the very areas of the cell that produce energy. So I took a little bit of aggravation on Tuesday because I was working with the Beets and not the Reds. And today I know I'm inevitably going to get some aggravation for having Reds and not Beets, but that's okay. I'm an equal opportunity red drink guy. So our physiology dictates our psychology. We talked about power position number one. Let's talk about posture in general, a big overview of posture. All right, so what we want to do is we want to imagine that there's a string coming down from the ceiling that's going to attach to the tops of our heads, and it's going to lift us. It's going to lift us up. We want to make ourselves as tall as possible. When you go to the doctor's office and they measure your height, you desperately want to eke out that last quarter of an inch, and you're reaching for the ceiling and you want the highest point of your head up top, not pointed down here. So let's imagine that there's a little eyelet on the top of the tallest point of your head and it's being pulled up to the ceiling. So we're lifting there. The second place we're going to make ourselves really tall is, and this is why I didn't tuck my shirt in, so I could reveal my belt buckle like a big game show reveal. My belt buckle to the bottom of my chest, the top of my abdomen, this region of my body. I want to be as tall as possible, as long as possible in this area. So I'm lifting my abdomen. And as I lift my abdomen, my chest is going to come up and back. So my shoulder blades, the wing bones, my scapula in the back of my body is actually going to point down and back. So if you could think about my belt buckle and it reaching and wrapping all the way around, I'm literally trying to touch my belt with my shoulder blades. I mean, it's impossible. I can't do it. I'm not that flexible. It might be possible for you, but it's impossible for me. Nonetheless, I endeavor to get there. And what that does is it just sinks my shoulders. It's going to sink my shoulders right in to a comfortable, good posture alignment. It's going to lift my chest up, and it's going to make me spacious in my abdomen, and my head is up to the ceiling. So I want to remain in this posture, whether I'm standing or I'm sitting. Now watch this. If I bring my arms up into my power position, my shoulder blades are still sinking behind me. I've just lifted up my arms into that position, and I'm going to hold it. And I'm not reaching, lunging, elevating my shoulders, shrugging my shoulders up into my neck. I'm just right where my body's designed to be. Now, if you employ this good posture that I'm talking about, using these couple of cues that I'm describing, one, the string lifting your head up, two, the lengthen your abdomen, forcing your torso backwards and down. If you're doing that, then what happens is you're putting your skeleton in its ideal physical alignment, which means that fewer muscles and fascia and connective tissue are going to twist and torque metrically and tighten and spasm and cause general aches and pains, cause ratchety movements, cause imbalances, cause generalized discomfort living in the only home you truly know, that is your body. What we're going to do is we're going to focus on being in good posture in order to create ideal muscle activity, ideal alignments in our skeleton. Now that we have the posture that we're looking for, I prefer to do this standing today. Sitting, that's also fine. We're going to sit in that same position, long in the abdomen, shoulders are back. And what I want you all to do is inhale through your nose as deeply as possible. And I want you to feel, as you inhale, your chest is coming out towards forward of you, your abdomen is coming out forward, and you're expanding in your torso like it's a giant balloon. What we are not going to do is shrug our shoulders up. I do not want to take this deep breath. I want to take this deep breath. So here's what we're going to do. We're in good posture. We're going to inhale through our noses, and we're going to blow up our balloons, and we're going to exercise our diaphragm. You ready? Inhale through your nose. Big in the torso, long in the abdomen, down in the shoulders. And we're just going to hold 1,001, 1,002, 1,003. And now let's blow out through our mouths and shrink back down to our normal size. And let's do that again. We're going to inhale through our noses, expanding our abdomen and our chest. And we're going to hold and hold and hold some more. 1,001, 1,002, 1,003, and blow out through your mouths. Slow, deliberate exhale. I'd like to do one more. Big, deep breath in through your nose. Everything is expanding and getting big and bigger and biggest of all. And we're going to hold again, hold some more, and blow out through your mouths. Okay. Our physiology or our activity is going to dictate our psychology. So after taking those 2 or 3 deep breaths in a row, how many of you feel pretty good about yourself, sort of relaxed, ready to take on the day, ready to take on the next project, ready to achieve, ready to get up off the couch and go for a jog? I hope all of you. So once again, we're at our workstation. We're putting in a long work day at the workstation in our second bedroom or our living room or our kitchen or wherever we set it up at home. We cannot spend those 6 to 8 hours right there in front of the computer without taking breaks along the way. We talked about during those breaks, we should do something physical. How about exercises that integrate your subconscious mind with your conscious mind? How about doing exercises where we're going to take those 3 trillion bits of information per second minus the 50 that are conscious and stimulate them in a way for our own positive benefit? Break number 1, power position. Break number 2. 5 or even 10 deep breaths. Questions, comments, moral outrages? Nothing. Good. So, what we want to do is we want to continue to talk along the theme about things that you can do that influence your subconscious mind. And now we're going to come to my absolute favorite of all time, and that is chiropractic adjustments. Using uh, um, uh, computerized technology to map the brain and to look at areas of the brain that light up with increased energy or increased activity based on whatever it's being stimulated by versus what causes the brain to decrease in energy or to decrease in activity. Chiropractic adjustments, now that we finally have the technology to verify what chiropractors have suspected for a very long time, we can see what a tremendous impact on the brain, especially parts of the subconscious mind, that chiropractic adjustments have in terms of areas of the brain which govern human balance, areas of the brain which perceive senses, our taste, our sense of hearing, our sense of touch, our tactile, and our proprioceptive senses. Proprioceptive meaning the link between balance and finding your way and orienting your position in space. The way the brain talks to the immune system, the way the brain talks to the cardiovascular system and the digestive system, the way the brain talks to the endocrine system. No, I don't want to stand here and tell you that a chiropractic adjustment is the panacea and it's going to fix everything that could potentially be wrong with you from the top down, from a brain-based perspective. But I certainly want to tell you that chiropractic adjustments have huge, huge impact and make big changes in the human brain in terms of how it's able to regulate and communicate with the human body. Reason number 643 to be a chiropractic patient. Now, we've talked about the breathing and the posture and the significance of a chiropractic adjustment. We're going to talk about one of my other favorite little tricks that I like to use, certainly to center myself and certainly that I've used to help patients center themselves over the years. The technique is called emotional freedom technique, and we're going to call it EFT for short. And emotional freedom technique is based on tapping. If you've ever heard of the movie or read the book, The Tapping Solution, that's a very good detailed explanation of what I'm getting at. But anyhow, what we're doing is we're going to use our own index and middle finger to tap on really, really specific specific points on our body, which are based on acupuncture. Now, the acupuncture needle is tiny. We're looking for a specific point that's so small that it would accommodate an acupuncture needle. We're looking at the surface of the size of our index and middle finger tapping on it. So if we're in the ballpark, that means we're accidentally going to get it right. We're going to get like a square half inch, or maybe square 3/4 of inch amount of space covered. And we're only concerned about one tiny little dot, and it'll be living somewhere inside of that space. So even if we don't have years of experience doing acupuncture, and even if we haven't trained with some of the grand masters in China, we're still going to be able to do this. Now, emotional freedom technique was popularized by a psychologist named Roger Callahan. And Dr. Callahan was working with guys who'd come home from Vietnam in the later 1970s. And these guys, if they were happening today, they would have been diagnosed with post-traumatic stress disorder, with PTSD. That diagnosis really didn't exist at that time. At that time, they had Vietnam War syndrome, and people were like borderline depression, not really eager to re-engage in society, having a difficult time communicating, having a difficult time expressing what was on their mind. Uh, um, Preferring to just be by themselves in their rooms in their hospital of a shelter, and the psychology staff was they're working hard. They're trying to get these people refocused and re-energized and reinvigorated and re-assimilated into society, and it's just not happening. It's not going well. So this guy, Dr. Callahan, he's one of these people who's just he's interested in everything, and he studies this and he studied that, and They like he's got the kind of knowledge base that it would, he's sitting there talking to Oprah, and Oprah's going to reach for her legal pad and pen and just, hey, doctor, will you repeat that, please? And just start taking notes. Just a interesting, multimodal, intelligent guy. And he'd been learning about this emotional freedom technique through his own private personal course of study. And he reached the point like, why not? What's it going to hurt? Who cares? Let's do this with my patient population. And he started to, and all of a sudden we start to see that these guys who have PTSD are starting to respond to treatment, respond to other treatments, slowly but surely starting to make improvements in their quality of everyday life. And that's how EFT is born in this country. Now, once again, I certainly don't want to present this as a panacea. I don't want to tell you that the EFT is a cure for depression. We're a long, long way from that point. But once again, activity is going to dictate your psychology. Doing something physical is going to influence your physiological processes that occur in your body at a subconscious level that you don't necessarily have control over. So what we're going to do is run through some EFT together. Now, what happens is, as I said, we're going to tap on these spots, spots plural, and we should be saying a mantra. Now, when I work with people one-on-one, or when I have a chance to talk to people and have an appreciation for what they're going through and what they want to work on and what they want to get out of this, we create a real individual specific mantra, and it would go something like this. While I'm tapping, I might say, even though I blank suffer from this anxiety, um, can't make a living, have a pain in my knee, um, can't cook dinner properly, even though I can't, whatever it is, or even though I have this challenge of, any condition that somebody has, we're going to fill in the blank. I deeply love and accept myself. And so we have to acknowledge the condition, but we have to reaffirm that I'm okay, you're okay. There's a little emotional freedom technique. So because I don't know how many people are logged in, I don't know who's paying attention. I don't want to make assumptions about, even though I blank, I deeply love and accept myself. So instead of using a mantra like that, we're going to do something much more universal, and we're going to change the mantra altogether. And what we're going to say is, I'm painting my life with my own brush. I am painting my life with my own brush. So what we're going to do is we're going to start at what's called the karate chop point. If I were going to do some karate and break a board, think about that fleshy point in the side of the palm of your hands who I want to make impact with. We're going to call that the karate chop point. So for the purposes of what we're getting at, we're going to tap on the left side of our body using our right hand, and I'm going to tap with my index and middle on my karate chop point, and I'm just going to say, I'm painting my life with my own brush. 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 Okay, now what we're going to do is move from that karate chop point up to that same spot. Remember, we had that eyelet that was just lifting the top of our head with a string to make ourselves as tall as possible. We're going to that same tall spot, and I'm going to tap right here. I'm tapping once again with my right index and middle, tapping, 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 and I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Okay, now we're going to move to the next point, and that's going to be, like, I got the midline of my nose, and I'm going to trace out, and I feel where my eyebrow begins, and there's a little divot, for lack of a better word, or it's a seam where two bones come together. And I'm just going to be tapping on that spot, and I'm going to say, I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. And now let's rotate out to the side of our eye. We're going to go to our left eye, and I can feel a bone right here, my orbital bone. And I'm going to slide just outside of that orbital bone, that ridge. And once again, I'm going to find a little soft divot where I have a lot of tissue, but I don't have hard bone, and I'm going to tap right in there, and I'm going to say, I'm painting my life with my own brush. 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 And now what we're going to do is we're going to rotate all the way down to the bottom of our eye. And once again, up here, I feel a bony ridge. That's the orbital bone socket. And I'm going to come just below it. And I feel like a little bit of deeper, thicker flesh. And I'm tapping on that same point. I'm tapping, tapping, tapping. And I'm saying that I'm painting my life with my own brush. 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 Now, we're going to come to the next spot. And right in the middle of my mustache, I have that seam between my nostrils where, once again, a little bit more flesh, and you have to push in much deeper before you get to the bone. And I'm going to tap on that spot with the same index and middle finger. And I'm going to remind anybody who will listen to me, most importantly, my own subconscious mind, I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. And now we're going to slide down and above my chin, below my bottom lip. Same thing. We got that fleshy spot where we have a little bit of a seam, almost like a joint, where two bones in the skull feel like they're coming together. And I'm going to tap right in that spot. And I'm going to keep tapping and tap some more and tap again. And I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Now we're going to come over here to our collarbone. Collarbone right here. It could be like a handle that you can just grab, pull off like a bone. And we're going to slide midline where the collarbone and the rib cage, the sternum meet. And I'm going to tap right in here. The sternum being this bone in the midline between your pectoralis muscles. And IT Savant Phil reminds me, don't knock the mic away. So on the inside of the collarbone, and I'm just tapping, 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 and tapping some more. And I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Now what we're going to do is we're going to slide down. Actually, because I don't want to incur the wrath of IT Savant Phil, I'm not going to tap over here because I have the microphone attachment. So I'm going to come over to my right side with my left hand, and I'm going to stay in IT Savant Phil's good gracious. And I'm coming, here's my armpit, and I'm coming down midline to the bottom of my rib cage right here at the seam. And I'm going to tap, 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 and tap some more. And I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Okay, now we're going to come over to our thumbnail. And if you think about your thumb, this part of my nail is further from my index finger. This part of my thumb is closer to my index finger. We live further from the index finger. So I'm tapping, I'm continuing to tap right along my thumbnail further from my index finger. I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Now we're coming to the part of the index finger that's closer to the thumb, further from the middle finger. And we're going to tap, and we're going to tap that nail, and we're going to tap that nail some more. I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. We're going to move to that same nail spot on the middle finger, and we're going to tap and tap and tap some more. I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my own life with my own brush. Big move here. We're going to skip the ring finger and moving directly to the fifth finger, the final finger, and we're tapping that same part closer to the rest of the hand, not further away, but closer. I'm painting my life with my own brush. I'm painting my life with my own brush. I'm painting my life with my own brush. Now, next transition, we're going to go to this fleshy muscular spot between the fifth finger and the ring finger, right here in between. And we're just going to start tapping here, and we're going to keep tapping, and we're going to keep tapping. And I want everybody to just stare straight ahead while maintaining your beautiful upright posture. And we're just going to keep staring, but we're going to shut our eyes as we stare. Keep tapping that same point. And as we are done with our eyes shut, now we're going to open our eyes, and we're going to rotate them around in a clockwise circle a couple of times. And then we're going to rotate them around in a counterclockwise circle a couple, 3 times. And now we're going to look down into our left as we keep tapping. And we're going to look down into our right as we keep tapping. And now what we're going to do is we're going to hum the alphabet as we keep tapping. Mm-hmm. And now the last thing we're going to do is we continue tapping. We're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's the EFT circuit. But we would be doing that with individual specific mantras to work on our own personal significant specific condition. Now, we went over 4 different activities that can be done to have special influence on the subconscious mind and begin to get it to change to a more positive place. 3 of which you can do on your own: the deep breathing, the power position, emphasizing your posture, and the EFT tapping. The 4th thing that you can do to help influence your subconscious mind to become a healthier, happier place, a more productive place, is to do chiropractic adjustments. That, unfortunately, I can't even do that for myself. Fortunately for me, I have Dr. Phil Ross, who practices here, who does a pretty good job of keeping me moving from a chiropractic perspective. We are taking new patients. This is a state-of-the-art wellness store, but it's also a chiropractic clinic, and we treat a number of patients with a number of different conditions, certainly from musculoskeletal aches and pains, discomfort, balance problems, imbalance problems, lack of coordination, difficulty finding your body in space, feeling just generally off physically. Those are the types of things. People who have challenges with acid reflux and heartburn, those are our chiropractic patients. Many of those patients also see one of our muscle therapists. We've always had outstanding muscle therapists here. Our newest muscle therapist who's here now is Andrea. We have a team of people who help out with nutrition. Both Dr. Phil and myself are capable of helping most patients get started with a nutritional program, but ultimately we're musculoskeletal chiropractors, neuromusculoskeletal chiropractors, and I don't pretend to be what I'm not. So fortunately, I work with both Joe Messino, I work with Jeffrey Niznik. Those guys are supremely well qualified and capable to help people put together nutritional protocols for a variety of different conditions and challenges to help get over those roadblocks and hurdles in the road. Um, if IT savant Phil doesn't have any questions, comments, moral outrage is coming at me from the screen, then I thank you all very much for your kind attention and indulging me. And I enjoyed this workshop. It's always a good time for me to get a chance to address the crowd and talk about what I'm up to and hopefully get people enthusiastic about it. Like I said, I've at least 50 of these wellness weeks for me at this point. Um, COVID may have limited the physical size of the crowd in our building, but the wellness weeks keep getting bigger and bigger because we always have new products. Jamie Dorley and Joe Messino and the rest of our advisory board and the Nutritional Frontiers team are always bringing out new products based on the latest research. This week, I've had a chance to talk with both the Douglas Laboratories and the Pure Encapsulation sales rep, and she was able to give me a heads up and some paperwork about product bios of things that they're coming out with that we're going to have here. We had Dr. Kathleen earlier in the week, and she gave a spicy and delicious workshop about hormones, steroids, and anti-aging. So what we're doing here, there's always more, but it always meets the standard that we've always run by to stay above board and only have the highest quality of nutrients here, to have only the highest quality caliber of hands-on care here. So I look forward to meeting more and more of you in person, and I look forward to May when I have a chance to host another conversation, and we'll go over some of this stuff again, and maybe we'll even go over some new stuff. Thank you all so much for your kind attention.